Tell me about yourself, sir.
Well, my name is Bill. I work for a construction company, Babcock & Wilcox. I'm an office manager, and basically we work mostly in power plants and refineries. And I've got my medical and dental insurance through my company, and I'm trying to get my smile brighter.
Awesome. I only producer. So, how did you find out about us?
Actually, you know, I don't know if I heard about you through someone else or if I just saw your sign outside. I think the first time I came here was about 4 years ago, and you gave me real good advice, and you helped me out as far as my front teeth. You actually gave me a temporary implant that lasted 3 years, and it should have lasted only 2 weeks. I should have come back and had the permanent done.
You mean a temporary?
A temporary bridge, yes, yeah.
Yeah.
And after my last job in Farmington, New Mexico, I cracked a back tooth, and Brenda called me that day by chance, and I told her that I'd be back in California here in a couple weeks, and as soon as I got back, I decided that I wanted to take care of getting the permanent implant or the permanent teeth done in front, and get the back one taken care of as well.
Cool. Experience with dental surgery like?
The dental surgery actually went a lot better than I expected. I was really kind of nervous and a little anxious about it. I don't know. I know a lot of people probably have I wouldn't say a bad experience with dentists, but just in general, it's something that is it's a nerve-wracking event, and you know, especially when you're talking about drilling into the bone of your mouth and all that. But overall, it was much easier than I expected. The next day, I really didn't feel any pain. I had a little bit of a puffiness and all that. I didn't feel anything during the surgery, actually. And David Kruger's got a great sense of humor, and he makes you feel comfortable. You know, I know Brenda, Danielle, David. I'm not sure what's the other guy's name over here.
Daniel.
Daniel's your son?
He's my son.
I thought I saw a resemblance. I mean, my face was numb probably almost till about 9 o'clock that night. I think I was done at about 5. It was a pretty lengthy. I mean, it was probably 2 or 3 hours that I was here, and I really didn't feel any pain. And the next day, I was able to go to work at 5 o'clock in the morning, and I worked a 14-hour shift, and I was able to go to work the next day, 14-hour shift, and it's gotten better ever since. The first couple of days, there was a little bit of puffiness where the stitches are. That I believe that the stitches are under my gums now. You know, so and I'm able to. I've been trying to use the soft diet as much as possible. You know, chew on the right side. You know, that's opposite of where the work was done. But I'm able to eat anything I really want. You know, aside from something really hard.
Use terms like investment. You know,
well, you know, I feel like as far as my appearance is very important to me, and I think it's it's stupid to say that you don't care what people think about you or how they look at your appearance, but I believe that the better you can look, the better you can be, and I think a smile is like one of the things that you really have to have in order to come across as a a genuine individual. And there's nothing, I don't know, it's just, I don't have nothing against people that are missing teeth, but there's no reason to be missing teeth.
It doesn't have to be you.
It's not going to be me.
Yeah.
And I mean, I want my smile to come across, my eyes and my smile, to be the first thing that people notice when I shake their hand. And then once they get to know me, it'll be gravy. But overall, I'm happy I'm going through this, and I think by the time I'm done, I'll have $1 million smile.
Good. So,
David Fred Kruger is the man. Look at the smile, right?